I'm Amber Beckenhauer. I am a rural family practice physician in Blair and Ashland, Nebraska. We have 2 clinics, and we offer family practice as well as quite a few other ancillary services.
Troy Mencke from Blair, Nebraska. Live out in the country on an acreage and have livestock and work for the Washington County Road Department.
Troy is a patient of ours. He's been with us since we opened.
Yeah, I didn't know I was really diabetic until I came to Dr. Beckenhauer, and she'd run tests on me, and that's how we got started on sort of treatments, and I hadn't said nothing really about the toe.
He was going to a wound care clinic outside of our area.
Yeah, after the casting for 6 weeks there, it was just bandages, keeping it clean. During the daytime, well, when you have farm animals and stuff, it's sort of hard to keep clean, and then at evening I'd be re-cleaning it, soaking it, and it just never did heal completely. So I was back to square one again because I couldn't keep going back to the doctor, even though she insisted that I go back, and I said I'm done with it.
Later in 2019, we had then met Enzo, and they offer PRP and PRF kits, and we really wanted to just be ahead of the curve and use some innovation. We've been doing it with other things in our practice, and we had a few wound care patients that we knew, and he's one of them, that needed wound care and needed it fast because they'd been dealing with it for years, and it was taking time out of their day, out of work, out of chores, out of all kinds of things that were just restricting their recovery. For us, it was like, okay, why would we even sit here and keep doing this traditional care that's not working when we have an option in our back pocket that we could try that could work in one procedure?
Originally, she called me on the phone and wanted me to come in and talk to her about it.
So we asked Troy if he would step up and be one of our big candidates for a PRF procedure for this toe.
Well, I thought it'd be great, so I didn't know at the time what all was going to happen, but I thought I'd give it a try.
By the time he came to us for us to fix that in November of 2019 with PRF, he had 2 wounds to work on versus just 1.
At the time of the interview, she told me it might take up to 2 times on the kit, but it was just the one time, and she could tell right away that the new growth was taking effect and all that, so we was just going to play it by ear, and that's all I needed was the one treatment.
From the minute I reached out to Pat at Enzo, it was just one of those things where he was excited to help. This is the field of patients he wanted to make sure he really focused on was, you know, a patient that is in rural America wouldn't have these options anywhere else, kind of have been scooted through the traditional system and had these huge bills built up, or maybe even they didn't have huge bills built up, they just didn't care for their wound at all, and now there was amputation involved. I mean, he's seen a lot of cases, even more severe than where Troy was. He didn't want it to get that way. I didn't want it to get that way. And our relationship just kept building because he kept offering great suggestions as far as how we could get our product into Blair, Nebraska and offer it to these people with wound care. And when you have a quality team as far as educating like Dr. Areva and Pat really, you know, talking about that product, is passionate about that product, it's hard to turn down using their PRF when you know that they're so passionate about what they do. Anytime you can offer a product that may be a one and done when it comes to a wound care is the answer, or at least the answer to start with for the first time. Because like I said, this gentleman came in after going to a wound care center for 1 year, every visit he had, and think about this, we're talking anywhere from 2 to 3 times a month going in there, $700 out of pocket. And you could potentially offer a procedure one time, $600, $700, $800, whatever it may be, and they're healed. If you have success with one treatment, why wouldn't you let all of your colleagues know?
Well, I was at the end of what I thought. If this ain't going to work, people said it was going to get amputated. And so I was at the end there, but for other people, I'd say, well, you have to try this. At least try something. You can't give up.
I like evidence-based medicine. I like having all of that background, knowing that things have been used for years, and it works and it's successful.
This was like a miracle deal for me. So as of right now, it's been healed for, I don't know how long. It's been a long time it's been healed.